1 in 5 kids struggle with a diagnosable mental health condition in our country. And half of all lifetime cases begin before the age of 14 years old. Half.
The Meridian Community Health Speaker Series provides us an opportunity to bring in experts and people with real life experience that can relate to the communities that we serve.
It's about coming together in different communities and seeing what we can do to help with that gap of service within those communities. And that's important to us.
I am so thrilled to be here. This community really has shown how much it cares about youth mental health by holding this speaker series and all the wonderful panelists that came in to speak today. The topic of youth mental health is so important, and I think we're in a crisis right now in our country, and we need to come together to support our parents, to support our children, to empower them to find the resources they need.
Boy, I can't say enough about Meridian being a tremendous partner of the schools, having that immediacy of some high quality, high care nurses and physicians, mental health providers is unbelievable.
There's a lot of stigma with mental health, and a lot of kids feel as though if they ask for help that there'll be consequences of it. So I think one of the biggest parts of having a series like this is just making public know that there's resources out there and that it's okay to ask for help.
I don't think you can treat just a child's physical health without also treating the mental health and the social well-being for sure. So at Meridian, I'm very lucky because I deal with the physical. I also do sometimes deal with the other aspects as well.
I listened to Randi at our speaker series today and how she talked about being engaged as a parent and really being able to communicate with your children, keeping that open line of communication, which is crucial.
We are now more willing than ever to talk about our children's mental health. I think there's a dynamic of shame and blame in our parenting culture, and a lot of misunderstanding that leads to silence, that then leads to more shame and blame. And the way to really tackle that is to promote open conversations.
There's an information piece. We want them to be informed, but we also want them to understand the resources that are available and to let them know that there is hope for whatever issues they're dealing with, and that we are working on this and we're trying to help in the best way possible.
Consistently, Meridian has been a support and been available. The availability of behavioral health services has really grown in campus, whether it's things that Meridian has added or other partners have added in the community. There's a lot more resources.
There is help there. Meridian does provide help in the schools, but part of the problem is children and parents don't know how to access it, or are afraid to access it, or think it doesn't apply to them. That's where I think speaking out and providing education and awareness is one of the most important things we can do to break the stigma.
When you hear a person's personal story, it's much more impactful than reading something online. I think that it's really an opportunity to hear that from somebody that has lived it and hopefully can share their experience.
Thank you very much.